Hi, this is Dr. Toby, your host on Health and Wellness with Dr. Toby. What an honor. We're delighted to invite you to watch our show this week with Dr. Brad Beeman. Dr. Brad Beeman has a unique medical history. Born with cleft lip palate, double cleft lip palate. For 17 years, he underwent 12 surgeries in North Carolina at the Duke Medical Center. In spite of all those difficulties in high school and elementary school, he went on and pursued medical school at the East Carolina Medical College, went through a residency in pediatrics, and is now doing pediatric emergency medicine. He has a heart for children. He's going to talk to you about getting ready for hurricanes and how to stay abreast with the best recommendations from the American Academy of Pediatricians. He's married, he has two lovely children, and he has decided to make pediatric emergency medicine his home. He's going to tell you about what he does and what he thinks will benefit you when you go to your pediatrician's office. You don't want to miss it. Jesus is Lord. Hi, this is Dr. Toby, your host on Health and Wellness. Thank you for joining us. We have an awesome guest, an awesome program lined up for you. You don't want to touch that dial. Dr. Brad Beeman came all the way from North Carolina, East Carolina Medical School, went there for undergrad, trained as a pediatrician, and is currently doing his pediatric emergency medicine fellowship at the University of Mississippi Medical Center. It's an honor, it's a privilege to call him a brother in Christ, a friend, a colleague in the hospital, and most of all, a devoted father and a husband. And we're here in West Monroe talking to a man who has made an impact in the few years or months that he's been in this state of Mississippi. I met him at a CMDA meeting, and he has a testimony. He went through 12 surgeries as a young child between the age of 1 and 17, or maybe even 0 and 17, to correct a cleft lip palate. He says it's a double cleft lip palate, but I just say cleft lip palate. And he's come out on top of that. I didn't know a few things about him, but he shared his story, how he was rejected 3 times in his application. He got accepted on the 3rd attempt to go into medical school. He got accepted on his 2nd attempt to get into fellowship. So we are seeing here a man of resilience, a man of passion, and a man who's focused on finishing strong and doing the will of God. It's an honor, it's a privilege to have Dr. Brad Beeman on the show with us today. Dr. Brad, you're welcome.
Yes.
Thank you so much. Thank you so much for taking our time from your busy schedule to be with us. So we're going to focus on the medical part of it. You know, one of the biggest challenges people watching who want to go into medical school is, I don't want to get into student loans. I don't want to owe hundreds of thousands of dollars, and I can't pay back for the rest of my life. How did you get through that hurdle? Did your parents just write a check and say, hey, don't worry, we'll take care of it?
No, they did not. My parents are very fortunate. My mom and my dad are just very hard workers, and God's been really good to my family financially. And so the deal my parents made with my brother and myself was they said, we'll pay for your first 4 years of college. Whether you get a degree by that point is up to you. Whether you pursue extra school after that point is up to you. But you get 4 years of college, and then we're done. So that left medical school on me, and so what I chose to do is I took out student loans, and I would encourage any potential medical applicant, I would encourage you to not let the thought of student debt get in the way of either pursuing where God's called you to be, because I think God provides for those he calls, and so and that's through different avenues. And so there are different avenues when it comes to student loans. A lot of the individual states have scholarships and programs where if you agree to work in that state for so many years, then they'll pay for your medical school, so you can look into that. There's the federal government that if you agreed to work in certain areas, will pay back some of your student loans. Or you can just choose to sign a good contract and pay them back yourself. But that you might be paying a while. So the point is that there are different options. I would encourage you to talk to a financial advisor. I would encourage you to just really be aware of your different options when it comes to paying your student loans, because the answer is going to be different for everybody.
Right. And I know there's opportunities for loan repayment
Yeah.
depending on where you work.
Right.
There's the health service corps,
Yeah.
and there's the most jobs will offer you a student repayment plan if you work for a number of years in a certain location.
Yeah.
So don't just say, oh, I can't do it. No, there are opportunities for that loan to be repaid.
Yes.
You may sacrifice where you work a little bit, but it's doable.
Right.
you know.
Absolutely.
Tell us about East Carolina Medical School. It's in Greenville. It's off the regular beaten path of it's not.
Yeah.
It's kind of in the rural area.
Yes.
Am I correct?
Yeah, you are.
It's not in Charlotte or Durham.
Right.
It's not. So it's not the most
well known.
So tell
Yeah.
us a bit about it.
Yeah, no. So East Carolina's mission is they want to be the national example for rural healthcare,
Wow.
and they're placed in an area to do so. So they cover the cities in Greenville. It's on the eastern side of North Carolina, and our patient catchment area is everything east of I-95 to the coast, from almost to Virginia, but definitely all the way down South Carolina to the border. And so our catchment area is enormous. We have many smaller community hospitals that are within our medical system through Vidant, which is the name of the hospital medical system there. And so what that meant for me training is
it a county? Is it owned by the county or is it owned by the state?
It used to be a county hospital, and then it got bought out by the private company Vidant.
Oh,
So now it's privately owned hospital, university affiliated. So the medical school is still East Carolina University, and the hospital is now private. But it used to be Pitt County Memorial Hospital.
But can we say that the university is state-owned?
Yes, the university is
It's
state.
state-owned,
And the
okay.
university is a part of there's a UNC school system and
Okay.
UNC health system, and East Carolina is a part of that health system.
Awesome. Okay.
So yeah.
Mm-hmm.
East Carolina got, I would say, bad publicity many years ago by being ranked one of the top party schools in the nation.
Well,
And I remember as walking into undergrad, that was something that I was a little nervous of, just kind of what environment am I going to be walking into. And I've had family and friends ask me whose children or who themselves are going to East Carolina, knowing this in the background, and concerned for their child, like any advice. And really the advice I would give them is just at East Carolina, you can find whatever you're looking for. And I think that's true for most colleges, that if you're looking for the parties, if you're looking for, even alcohol and drugs, like, you'll find it. But if you go looking for Christian community, if you go looking for discipleship, if you go looking for good mentors, you'll also just as easy be able to find that too.
So in a nutshell, East Carolina Medical School offered you an opportunity you were the only hospital for miles.
That's right.
Like major tertiary
Yes.
hospital. So you saw a lot of cases.
Yes.
That if you were in a big city with competing hospitals,
Right.
You may
Yeah.
see, you may not see.
Right, and the cases that we saw, some of them, the disease process was so far advanced that was really good training for us
Oh, wow.
as well.
Interesting. I've never been to Greenville, North Carolina. I've heard of Greenville, South Carolina. So
Yes.
now you stayed back after that for residency. So that's interesting. You did undergrad, medical school, and then you did
Yes.
residency. That's pretty novel.
Yeah, so I really liked the mission and vision of East Carolina. The physicians who work there they come from prestigious places, and they could
Right.
easily get jobs elsewhere. So what that tells me is that they are choosing to stay there because they're also on board with the mission and vision of improving the healthcare in that rural community and in the rural eastern part of the state. And that was something that really resonated with me, and I was honored to be chosen to do residency there.
Awesome. Wow. Tell us you told us exactly, You talked about a bit of it going into pediatrics. You love science. You could have gone into surgery, medicine, psychiatry, but you chose pediatrics.
Yeah.
And I think you said it was because of your love for children. Am I correct?
Yeah, that and just being a pediatric patient growing up.
Growing up, you saw that influence. Okay. And was there any other inspiration towards pediatrics in particular? Was there, I mean, some people say, oh, God told me. Some people say, I just felt that. Was there anything other than what you experienced as a child? Was there any other input choosing pediatrics?
Yeah, I think mainly.
And then pediatric emergency afterwards.
Yeah. I think mainly it was just kind of the childhood experiences.
Okay.
The other benefit of pediatrics is just the fact that even though on a bad day, you still get to play with a toddler usually.
Okay.
And so.
That's fun.
Yeah, so we enjoy ourselves. And the group as a whole tends to be kind of a more lighthearted group of people. So I found myself enjoying work much more when I was doing my pediatric rotations as opposed to some of the others.
Wow. Now, you said you had 2 years working. You did, after your residency, you worked as a chief resident.
That's right.
And then you worked as an attending faculty at East Carolina for 1 year.
That's right.
Okay. So tell us a bit about your experience as an attending faculty, as attending pediatrician.
Yeah.
What did it entail? What was your routine day?
Yeah.
And
so I was strictly outpatient, so that meant I worked only in the clinic environment. I wasn't working in the hospital during my attending year. During chief year, I would do both, but during attending year, I would just do that, and then otherwise, I would be able to still teach medical students and residents both in lecture and kind of on the job. I think one of the big things that came with being an attending is just the fact that the decisions that get made kind of go on your medical license, and so for better or for worse, so it definitely caused me to just kind of take that extra step of caution of, is this really the best thing for the patient that we're about to do or that we're going to recommend? And so, but it also was really good for me, especially to be able to work full-time before fellowship, because fellowship, you come in and there's so much for you to learn in this short time. The good part, the advantage I have is I'm walking in with lingering questions about patients that I'm carrying with me from the past 2 years. And so when those answers come, then it's going to be easier for me to latch on and remember them.
Completes the loop of understanding.
And so I think that's a benefit that I've had from being an attending.
Okay. So a lot of my patients take their kids to pediatricians every day, literally.
Yeah.
What do you recommend they ask the pediatrician? What are the high points of a visit to a pediatrician? What do you think the parents should highlight when they visit their pediatrician for their child?
Yeah, no, so that's good. So there are two kind of broad categories of pediatrician visits that take place. One is a well-child check, and one is a SIG visit. There could be a third group about kind of chronic disease management. So first of all, you have to be able to trust your pediatrician. I had my realtor tell me when I was coming down here to Mississippi, she said, Brad, you have to trust me. If you don't trust me, then it's not going to work out for any of us. And she said the same way with you and your patients. Like, if you don't trust your doctor, then it's really, you're kind of wasting your time seeing them, because you have to have that level of trust. So one, I would say find somebody you trust. Two, the American Academy of Pediatrics and then the American Board of Pediatrics certifies physicians. And so that's one way that we as a community, as a medical community, strive to earn your trust. And so you can go on the American Board of Pediatrics website and easily type in the name of your physician just to make sure that they are board certified. You're legally allowed to practice medicine without being board certified, but it just offers that extra layer of kind of protection, I believe, for you, the patient, to know that who you're seeing is up to date on the most recent guidelines. So I would check for that. As far as things to bring up, so during the well child checks, You want to ask questions as far as like what's coming next developmentally for your child, things you can look out for, and there should be specific things that your pediatrician recommends at each different stage of life, and even like when do you baby proof your house and when's the appropriate time to do that. So things like that. At the sick visits, being able to, so sometimes we as pediatricians and as scientists and physicians, we can get so wrapped up in the details that we say everything we want to, but you walk away very confused. So from sick visits, if you can walk away with what is wrong with my child, what do I need to do about it, and why is it important that I do this? If you can walk away with those three questions, then I think you're good. And if your pediatrician doesn't clearly state those to you, I think you're in every right to ask directly, like, hey, can you tell me again what's wrong with my child? Can you tell me again what I need to do and what happens if I don't? And what are the risks involved? And so I think those are really helpful with sick visits. And then with your chronic management, so things like asthma, things like ADHD, things like obesity, things that are going to be dealt with over the years, being able to hear from your pediatrician kind of what we're doing today and then what's the next step in several months or what's the overall plan, I think is good to know.
A lot of our audience are Christians, and there's been this debate in the Christian community about vaccines for years. So since you're a pediatrician, I have you on my show. I want to ask you, what do you tell those Christian parents who have been told that there's a conspiracy theory to give their children all kinds of autism and diverse diseases
Yeah.
through getting the vaccines?
Yeah.
What's your thoughts on that?
No, that's good. Thanks for just allowing me the opportunity to share. So I'll tell you, both of my kids are fully up to date on their vaccines. Me and my wife are up to date on our vaccines. We do not see the number of measles cases that were seen 20 years ago. We do not see babies die of meningitis from bacteria like we did 20 years ago. And a large part of that is because of vaccines. The study that came out years ago that said certain vaccines cause autism, mainly the MMR and varicella vaccine, that study has been retracted, has been proven false. There have been countless other studies that have shown that there is no relationship, there's no association with vaccines and autism, and that autism is a syndrome that although we're still learning more and more about it as we look into development pediatrics, is one thing we do know is that there is no relationship between that and vaccines, that kids who never get vaccinated can develop autism, and that is just a completely separate process. The other thing I would encourage you as far as with vaccines is I encourage you to have an open mind and to be able to look at the literature for yourself. So you are in every right. I enjoy when parents who may be hesitant about certain vaccines ask me for information. The American Academy of Pediatrics, the CDC, they on their websites, they list some really good information about vaccines, about specific individual vaccines. And then your pediatrician should have a handout that they can easily give you that outlines the risk of the vaccine, the benefits, the alternatives to the vaccine, and things of that nature.
And I know there was a controversy about mercury and the thimerosal.
Yes.
So I think they've changed a lot of those vaccines now
Yes.
that used to contain.
They did.
Mercury.
So they did used to contain mercury. They did used to contain certain things just so the vaccine would stay fresh. And then since then, the vaccines now have much lower amounts of those things within them. The study that came out that just raised awareness of the mercury and thimerosal, I think, was done somewhere in Japan, where the concentrations of the mercury were much higher than they are here in the United States. And one thing to think about too is when you get worried about mercury and aluminum and all these heavy metals, is to know that the heavy metals are in the dirt and they're in the crust of the earth. You get exposed to aluminum every time you go outside, and that your baby is getting mercury and aluminum through your breast milk that you've consumed. Either maybe you've just ate some fish and now you have a little bit of mercury in your system. And so, but yeah, the point is the vaccines today are safe and effective, and they've been studied and proven to be so as well.
Awesome. Excellent. Thank you so much for that. Tell us a bit about what are your greatest challenges you faced in practice as a pediatric emergency medicine fellow? I mean, people want to know what you do. That's why I'm trying to paint this picture.
Yeah.
Okay, so they've heard the story of pediatric emergency medicine, but what does a pediatric emergency medicine do really? Who do you see? What are your terms of reference really?
Yeah, no, that's good. So we are in the pediatric emergency department. We see patients from 0 to 18 years old. Some kids have chronic and complex medical conditions, and they follow their pediatric specialists well, like into their 20s. Oftentimes we'll see them as well. And we want to be the place where you turn to when there is a medical emergency. The physicians who work in the pediatric emergency department are becoming more and more specially trained in how to deal with pediatric specific emergencies. There are emergencies that happen only in kids, and they don't happen in adults because of different developmental stages. And so, so we see those kids, and then we also are specially trained to know who needs to go into the hospital, who is safe to go home. And so you could potentially save yourself a hospital admission by going to a pediatric emergency department as opposed to an adult emergency department.
Tell us about, in this COVID era, what should parents who take their kids to the emergency room be concerned about? And if they're worried about COVID, what are the signs that they need to bring the child to the emergency room? Because we always say quarantine, stay indoors. And since you're a pediatric emergency room, I'm sure you're aware of the protocols in your department. What are those things that require your parent to bring the child in? If they're worried, if the child has been diagnosed with COVID, what are the let me use the word, the red light that tells you this child needs to be brought to the hospital, brought to the emergency room, kept at home?
Absolutely. There is with COVID that something called there's a multi-system syndrome and disease process that is now starting to come to light with COVID, specifically with kids. And so if your child has COVID and has a positive COVID test, and if they stop drinking, so if they refuse to drink for you, if they're in diapers, if they stop peeing, so they're not making wet diapers, then that by itself would be a reason to come to the emergency department. Any respiratory issues, so they can't breathe well, they can't breathe like they should have breathed. If they have an underlying medical condition, such as asthma, and you're needing to give them albuterol more than you normally would, that could be a reason to come to the emergency department. If their pain or fever is just not being able to be controlled at home. And a lot of times I tell parents, the purpose of Tylenol is really so your kid feels well enough to drink. That if they can drink, then that's what we need. And so once they stop drinking and once they stop peeing, that's definitely a reason to come to the emergency department. The other thing I would stress is your pediatrician should be a phone call away. There are a lot of guidelines now that state that, or at least recommend that pediatricians in some manner should have their office available to you by phone in case you need guidance. And so what makes the medical system flow smoother is if you call your pediatrician, hey, here's what's going on with my kid, and then let your pediatrician say on the phone, okay, do X, Y, and Z and call me back. Or your kid, maybe they don't need to go to the emergency department, maybe they just need to go to an urgent care. and can you take your kid there? Or maybe they can come into our office. Or they may say, you know what, like, man, your kid is much more sick than even you thought, and they need to go to the emergency room right now. You need to call 911. Your pediatrician is going to be your go-to source for what to do, and sometimes the pediatricians can even call the emergency department and let us know that your child is on the way, and that will do nothing except make their experience better. So reaching out to your pediatrician if you're ever concerned about your child is always the right answer.
Awesome. Wow. Thank you so much for highlights. You talked about role models earlier on. Did you have any role models coming into medicine?
Yeah, I have role models within medicine. I think you will become one of them. But otherwise, so Dean Patton he was one of the CMDA physicians. Alex Dalzell is a pediatric infectious disease physician in Greenville who just poured into me and my wife's life. And then I think about there's physician Drew Baker, who is our chief of pediatrics, and just the mentor that he was to me even just last year. Karen Hillenbrand, who is nationally known through the AAP, who is our program director, and she was our program director for like 20 plus years
In East Carolina.
in East Carolina. And so she actually taught the majority of pediatricians that work at East Carolina today.
Oh, wow.
She taught them when they were residents, and she has a gift for teaching and organization, and she is definitely one of the best program directors, if not the best,
Wow.
in the nation.
What do you see yourself 10 years from now?
Man, 10 years. Done with fellowship.
Obviously.
Done with training. But never stopping to learn. So 10 years. So I see myself loving, serving Christ in wherever He's called me. I see myself loving my wife, raising my kids. I see myself in a leadership role in the local church in whatever capacity God wants me to serve in. I see myself working as a full-time pediatric emergency physician. I see myself meeting with and pouring into other physicians and pointing them to Christ. I see myself going on medical missions trips about 1 month out of the year. And one good thing that ties into ministering to our colleagues is Christian and non-Christian physicians love to serve. And so I have this secret ninja plan to bring non-Christian physicians with me to the medical missions field, let them see Christ on extremely fertile soil,
Wow.
and hopefully let Him show His glory off to them.
We've been honored, privileged, and delighted to have Dr. Brad Beeman. He's a native of Cary, North Carolina, currently living in Jackson, Mississippi, or Flowood, Mississippi, but working in Jackson, Mississippi. And he's shared his heart with us. It's been an honor and it's been a delight. I'm sure you were blessed. I'm sure you were educated. I'm sure you were enlightened. Join us same time next time. We have Holy Ghost Night. Check us out, faithandpower.online, P.O. Box 550, West Monroe 71294. Anytime you need prayer, just let us know. God bless you. Jesus is Lord. Amen.